Dr. Dolan, you want to turn on your mic?
I want to thank Catherine for allowing us to participate, and thank the Institute of Medicine. So as a district coordinator, so I have many masters and lots of accountability, and I also sit at a state team. So I see the national data, the state data, and our local data. And so when there's a problem with bullying, it's sort of like they call Ginny and go fix it, and and then I'm an N1. So I look to the researchers, and we've been fortunate to work extensively with Catherine over the many years, and we appreciate her support. And she's helped us, and I think we've given her lots of food for thought. So a lot of the information, on the one hand, validated where we are and where we need to go, for sure, and what we've been doing. But I pose this issue with you. Is bullying a priority? And what happens, we think, is that our data looks very low, and whether it's the reported incidents or the actual consequences for the discipline sanctions. So is it masked? Is it masked, or are there elements of bullying and other behaviors that are counted as aggressive acts and defiance and whatnot? Or is it a political issue because, it becomes a hotbed issue when a school or a school district has a number of incidences about bullying. It rouses the community. And we had a death of a student recently around bullying, and so it really is a hotbed issue. So I pose that for folks. So how do we make it a priority, and for everyone? I will say that the tendency for school systems, having been a district coordinator, but a school psychologist and also a teacher in 5 states, what happens with school systems is they take something as discrete as a program and then try to implement it, and then whether it's with fidelity or not, and then wonder why it doesn't work. And I think Will is very modest, but one of the exciting features of his high school, South River High School, and Will as a leader, is that they spent a year really working on the structures around what they needed to do to get this thing going. They just didn't drop Alveus, and they did use Alveus at a high school level, but they twisted it into a context that would fit their needs. So we have fidelity issues, but Catherine, you can take care of that later in your research. But what we have to look at is the climate of the school, and that will say volumes about what can be done and what can't be done. So we've learned that lesson the hard way. Another issue that we have been struggling with is really trying to connect the dots. Researchers brokered this information to the districts and then the implementation. So schools and districts are looking for more tools in their toolboxes. We're looking for best practices, and here's on us. We need to be more accountable for what we're doing in terms of the implementation. And one of the pieces that has been so successful about the multi-tiered systems of support known as PBIS is that it holds the schools accountable. I mean, they pay attention, as Will knows, we're collecting data now, they pay attention to their set scores. They pay attention to their scores. And I don't know too many other programs where the school is given a score around implementation. Now, the state was very smart, and we tied it to some incentives around that, but I think that's important. And then, of course, the neurocognitive slides were very powerful for us. And again, I go to, we're as a district struggling with disproportionality around student behaviors. Soft offenses, we refer to them, defiance, disrespects, and then the more hard offenses, fights and attacks. And I think bullying is subsumed in there, for sure. And we were very much struck with and frustrated and saddened and not, where do we go from here, with the reality that hits us of the impact of stress and poverty on the brain, the developing brain, memory, learning, and so forth. And so when we wonder why we have such disproportionality around certain issues, a lot of issues, frankly, and it's around poverty you know, we know it's biologically based, or somewhat biologically based, so help us with where we need to go. I mean, I think there's some folks out there who are talking and writing about it, but we really need some real evidence-based programs that will speak to this for schools across the state, across the nation. I think those are most of my remarks. Thank you.